My name is Dr. William Henry Duncan. Have any of you ever heard of me? Now, for those of you who don't know me, right, I was born here in Liverpool in Seal Street, 1805. I first of all went to school here, but then I moved to Scotland, where I had a better education under a reverend up there. But then, after school, I then went to college. I then became a medical doctor of health. I passed a degree. But did I stay in Scotland? No. I came back down to Liverpool, where I thought I would be of much more use.
Well, Dr. Duncan was working in Liverpool at a time when Liverpool had grown, the population of Liverpool had grown hugely, massively in fact, and disease was becoming commonplace. He saw this correlation between overpopulation and disease spreading. Maps showing cholera and typhoid with little red dots denoting where the most deaths were. He was horrified at the high rate of mortality and believed something should be done about it.
Because, let's say, Liverpool at one time was known as the black spot on the Mersey. It was the most unhealthiest place in the world, people say. But I don't see any reason why that can't change.
He produced a booklet, The Physical Causes of the High Mortality Rate in Liverpool, and this shocked the council, and that pushed them into making the Sanitary Act, which brought in the beginnings of public health as we know it. It was a public health team with Dr. Duncan as the first ever medical officer of health.
1847, 10 years ago to this very day, 1st of January, I then became the first medical officer of health in Liverpool, if not the world.
Thomas Fresh, Inspector of Nuisances, and James Newlands, who was the civil engineer, who between them they revolutionised Liverpool. They had a huge impact.
Well, Mr. Newlands came up with another idea. He came up with the idea of sewerage. That is the sewer.
Very little fresh air in court housing. It was housing facing each other with cellars.
You would have about 5 rooms on the bottom here, 5 rooms on the bottom here, about 3 stories high.
Very little, if any, water supply. There were no working sewers. So when you think of babies, families, it must have been a really unpleasant place to live. Dr. Duncan totally recognised that cross-infection was happening because of these conditions. Dr. Duncan was very much a man of the people. He lived with the people. When people were dying of cholera, he didn't move out to a safe distance. He went to their houses. He has a love of the city, he obviously has a love of the people, and he wants to get conditions improved. And it's Dr. Duncan who laid the foundations for the public health service we have today.